While in parasitic diseases, we can find it from contaminated food or water, dog bites, sexual contact, walking barefoot, inadequate disposal of feces, and of course, lack of hygiene.
The infectious agents in fungal diseases are mostly found in soil. The other sources would be dust and bird droppings. In viral infection, we can specifically find infectious agents through sexual contact, dengue, especially Egyptian mosquito. Neonatal varicella infection may be acquired in utero or perinatal period, result in congenital abnormalities. I forgot to introduce to you my colleague, Dr. Yvonne Arden. Let's welcome Dr. Yvonne to the show.
The arrival of Dr. Yvonne Argente, our other colleague. Welcome to the show, Doc.
Thank you.
Okay, to continue, how does our immune system respond to these specific diseases?
In bacterial diseases, the presence of key substances and the process of phagocytosis represent major immunologic defense mechanisms against bacteria, while in parasitic diseases, some cestodes, especially in their larval stages, may be eradicated by complement-fixing IgG antibodies, and increased levels of IgE may be noted in many helminth infections.
In fungal diseases, it would manifest allergic reactions which would cause rise in antibody titers, which then could be detected in laboratory examinations such as enzyme immunoassay.
In viral infections, interferon plays a major role in defense against viral infections. Antibodies are viable in preventing the entry and blood-borne spread of some viruses, but the ability of the other viruses to spread from cell to cell places the burdens of adaptive immunity on the cells.
And also the T-cell system, which specializes in recognizing altered histocompatibility antigens.
So, what laboratory examinations can be done to identify and to diagnose that a patient has bacterial, fungal, parasitic, or viral infection?
When it comes to bacterial diseases, blood culture testing is used to identify a blood infection that can lead to cysts, while in parasitic diseases, ONP exam or ova and parasite exam, which is used to determine whether there are parasites present in the lower digestive tract.
There are 3 laboratory exams to diagnose fungal diseases. The first would be direct microscopic exam. The specimen will be treated with 10% potassium hydroxide. The second would be the culture of organism in Sarborod's agar. The third would be the serologic test. It would detect the presence of antibody in the patient's serum or spinal fluid. If there is a rise in antibody titer, it would confirm the diagnosis. So the examples of serologic tests would be complement fixation test, enzyme immunoassay, immunodiffusion, and fluorescent antibody test. For us physicians, we undergo torch testing.
Procedure that specifically evaluate the presence of IgM or IgG are frequently used to detect CMV, herpes viruses types 1 and 2, Toxoplasma gondii, and
It's a lot of information that we gained, right? I hope the viewers are knowledgeable enough already regarding these things, since our physicians have already shared such informations. And to have an overview of the laboratory examinations, we have our reporter from Adventist Medical Center, Iligan City.
For the laboratory detection of immunologic response, detection of specific IgM can be diagnostic significance since IgM is usually produced in quantities large enough to be noticed during the first exposure of the patient to an infectious agent. In many diseases, cases, infected individuals show a spectrum of responses. Serologic diagnosis of recent infection using acute and convalescent specimens is a method of choice.
Torch testing. Procedures that specifically evaluate the presence of IgM or IgG are frequently used to detect CMV, herpes virus, Toxoplasma gondii, and rubella. Torch means Toxoplasma, rubella, CMV, and herpes. A spectrum of congenital defects is called torch syndrome. These congenital defects may be asymptomatic. This so-called torch testing is ordered of the pregnant woman and is suspected of having a torch infection. Toxoplasmosis infection during pregnancy can cause congenital infections such as mental retardation and blindness. Rubella virus infection during early pregnancy can lead to severe defects known as congenital rubella syndrome. Lastly, we have latex cryptococcus antigen detection system. This is a simple, rapid latex agglutination test. It is a qualitative, semi-quantitative detection to help diagnose Cryptococcus in serum or cerebrospinal fluid. For being here in Salamat Doc. And to all our viewers out there, let us always remember that prevention is